about all things ketamine therapy, the most talked about thing, I think, in a lot of ways amongst the mental health community and psychedelic medicine in general. So our goal and objective for this podcast is just to answer the questions that I'm sure a lot of you have been wondering about, questions that we hear a lot from our prospective patients that come through, and just kind of give our community a forum to really listen and deep dive into these things. And so we have a slew of episodes lined up where we'll cover everything from the origin of ketamine and the history to the process itself, the sensation, the experience, all the way down to like the research and the success rates. And hopefully the goal is to not only destigmatize this treatment as a credible option for someone that has been struggling with depression, anxiety, PTSD, but also help to inform the public. There's a lot of misinformation that spreads around, and we feel, personally responsible for ensuring that we do our part to ensure that correct, factually based information is available for people when making decisions for their health. This is, of course, our opinions. This is not to replace medical advice from your own healthcare professional, so make sure that is a conversation that you still pursue with whoever that might include. But we'll jump in. Let's start with some introductions. So first and foremost, I'm Ashlyn. I am the host of this podcast. I have enough information on ketamine to be curious and dangerous, but I am certainly not your expert. So over the course of our podcast, we will bring in other experts to help kind of deep dive. And so welcome to the podcast, and we're excited to start this journey. Our first episode today, we will have our very own medical director, Dr. Nathan Gilmore. Hi, Nate.
Hello, good to see you again.
Yes, thanks for being here. And I think we wanted today just to kind of talk about like the field guide of ketamine, like start from the very beginning of what it is, how it started, its origin story, and maybe before we jump into that, we can learn a little bit about you and your background and your role at ANU.
Happy to. So, I'm primarily an intensive care doc. I have been practicing that for about 10 years now. I also did emergency medicine for a number of years before that. I'm from Utah originally. I practice in Utah and in California, and I've used ketamine in my armamentarium for emergency medicine and critical care frequently. It's a commonly used medicine for what we use. My colleagues that are anesthesiologists use it as well, and so I'm familiar with its side effects and its treatment and its benefits, and this extra new adventure for me has been extremely rewarding because it's a lot different than patients dying on ventilators and massive hemorrhage and things. It's a very different practice of medicine. It's got a special kind of reward for me, and a lot of personal experiences with family and friends as well that have had some tremendous benefits from ketamine. So it's been a fun journey for me, and I'm excited to be here now with you as well as to be participating with the ANU team and helping us grow this important area of healthcare.
Okay, great. So within your role as medical director, what does that entail? What does that mean for the viewers that maybe don't have a reference point?
Yeah, so I'm the supervising physician, which means policies, procedures, making sure our treatment pathways are best practice and supported by best literature of the research supporting medical care. And I am required and grateful to be able to supervise other practitioners, physician assistants and nurse practitioners, and make sure their experience and knowledge base is absolute top shelf, and help coach the team on the current and future best ways to provide this essential therapy.
All right, well, let's jump in. I've got a slew of questions for you today.
All right.
So we're going to put your medical expertise to work.
All right.
So, this has been a breakthrough treatment. I feel like in the last 5-7 years, you're hearing more and more about ketamine therapy and the success it's having for people. But let's kind of just start from the beginning of like, what is ketamine, the drug itself? Like, is it FDA approved? Like, just kind of help us understand the drug and its profile a little bit more.
Yeah, so ketamine was invented in the 60s and was explored for anesthetic uses, for sedation and allowing for surgical or painful procedures to proceed. just like you think an anesthesiologist does for your knee surgery or whatever. It found great use during Vietnam, actually, where they were able to use in the field. They could administer it for painful type procedures without the need of all the rest of the apparatus, like oxygen, breathing machines and all that kind of stuff that you think of for an operating room.
So it was like safer. It was a safer anesthetic.
Safer, easier. It was just, wow, this is a lot simpler, and the military likes that in those environments. In the field, you can think of like battlefield type things. It had other benefits that were being explored, and anesthesiologists adopted it fairly rapidly into their tools. It's one of their tools, not the only one. And it continued to be explored and then recreated upon as any medication that is out there. People play with it and use it inappropriately. And, the 70s were the 70s. And so fast forward to the 2000s, and they've been using it for anesthesia this whole time, and for animals. They've used it for animals, for anesthesia uses as well. And in the 2000s, they started noticing mental health benefits, and they did more research on that specific aspect. There were some case stories of those wartime episodes where soldiers that received ketamine had less PTSD and or memory of the catastrophes that they faced and lived through. And so those stories lived on, as well as the recreational experiences of hallucinations and mind-altered condition from both the anesthesia world as well as the people using it inappropriately. And so they decided to study it in the 2000s.
Got it.
And that got us, where we are now, where we started really researching what it does for mental health and your global mentation, not just the episode for your hip surgery or your other anesthetic use.
So I know, I'm sure there's a lot of people that have seen the documentary on Netflix and stuff about this suite of psychedelic medicines, which I know there's some opinions on whether ketamine is truly considered a psychedelic medicine or not. It certainly has psychedelic properties in terms of the experience. But it sounds like, around the 50s, 60s, 70s, there was this, movement of psychedelics in terms of LSD and other things. And there was actually a lot of federal studies, I believe, that were actively going at that time to study its effects on mental health as well as trauma. And if I'm not mistaken, it was also being tested for alcoholism. And, once those became, classified drugs, controlled drugs.
Controlled registered drugs,
Those studies stopped, and we lost that really, I imagine, what could have been really important data for us to make decisions on mental health and our medicine and our approach as physicians. But it's really fascinating to hear about the soldiers in Vietnam. I'd like to hear a little bit more about that. So the PTSD component, are you referring to the trauma of that particular injury and then having, I guess, they processed it better following, or could you explain that some more?
So now that we know more about the chemical pathways of ketamine, as well as the additional research behind it, it helps us better understand what was happening in Vietnam. So these soldiers had traumatic events, which could be just shell shock,
Okay.
They feel like they're going to die, so they're, curled up in a ball,
right,
which happens in every war.
Yep.
They also can have life-threatening injuries that hurt like crazy and or need surgeries that hurt like crazy. So those events, when you receive a ketamine treatment for your anesthesia, basically, those patients had fewer experiences of and less severe experiences of PTSD over time. And that's what perked their interest, saying, well, there's a mental health benefit here. It's not just useful to get through the surgery and get through the bone fracture treatment. It actually helps them in the long run too. And that's what helped us go down that road of more research and investigation and see which medications help, which ones don't. I don't want to diminish the research that was done and overplay the recreation. The recreation, I think, helped people's minds be open to it, but it also created stigma.
Right.
And thereby, in some ways, prohibited more careful exploratory research because it was being abused at the same time.
Yep. Which is true for a lot of medicines. Yep. It's a similar story.
Yep.
Okay, yeah, that makes a lot of sense. And the origin of it is, I think, really fascinating. But I think chemically, a lot of people don't really understand what is actually happening. So, yes, we know it. You mentioned it's kind of used in a surgical sedative, anesthetic state, right? But like chemically, what's happening in the brain when you inject ketamine?
So it's a very potent, active psychotropic medication that it's strong. It affects multiple neuroreceptors in the brain. And so the neurons themselves are activated or turned down based on which neuron they are. And that interaction leads to, they call it a dissociated state, wherein once there's enough medication in your system, you then are in a sleepy, mind-altered state. There might be some hallucinating. There might be some distorted perception of reality. Mm-hmm. And the more you get, the stronger, the higher the dose, the more out to lunch you are, the more you are not in the realm of current mentation with the rest of us. So there's a sweet spot of how much to give to get the best anesthetic result.
Sure.
And that's actually different from what the best mental health result.
Which is like miles apart,
totally separate,
right? Like
totally different beast.
Okay.
And the chemical reactions in the brain from the ketamine affect different neurotransmitters at different levels. So the NMDA receptor in the brain is the one that we think is most relevant for the mental health benefits from ketamine, and it helps with neuromodulation and neuronal remapping, which is so profound and so, I mean, it sounds like, the fountain of youth kind of stuff. And in some ways it kind of is. It allows your brain that is used to having these historical neuron pathways of electrical firing to reset and start some new maps, some new pathways, which include maybe not being as depressed or as anxious, and or even avoiding PTSD, ruts of PTSD, which anyone who has depression, anxiety, or PTSD can understand and remember, I have these ruts that are just really hard to get out of. Mm-hmm. And this helps the neurons themselves remap.
So you used a lot of big words there.
Yeah. It's hard not to.
It all sounds like it should all make sense, but for me and for others that maybe don't have the, background in neuroscience and stuff, maybe we can find a way to kind of like explain this metaphorically. It sounds like you're using the word pathways. So the brain is composed of a series of these neural pathways, right? That drives our thinking, our decision making, our feeling. Am I capturing that correctly?
Yeah. So the brain is a neural network. So a bunch of neurons are separated, and there's connections between them called synapses. And the most common needed pathways for spoon to mouth to eat, right?
Okay.
We can do that in our sleep, basically. We can feed ourselves, right? Because those neurons have connected that pathway so often. It's a well-worn path. Same with walking.
Yeah.
Talking. So you learn this as you grow up. You learn these pathways that help you exist as a human. And some of those pathways can be well-worn, which are bad for you, like obsessive depression,
right,
or obsessive compulsive disorder, or severe anxiety, where the neurons that are the pathway of synapses that triggers you into this super depressed state or super anxious state gets so used to it, your body gets used to it. So these neurons are used to being in a depressed state, and your hormone level in the brain and the rest of your body gets used to living like that. Mm-hmm. And so getting out of that pathway requires a new map, a new neuronal synapse. Instead of taking the well-worn path of synapses, let's use these other neurons, which aren't as adjusted with the serotonin and dopamine, which are other neurotransmitters that are very involved with mental health. And so these neurotransmitters are impacted as well. But that gets into biochemistry and some of that other stuff that maybe a little more nerdy than most people want to talk about.
We love nerdy. This podcast is all about nerdery. So you're in good hands here. One way that I heard someone explain it to me was that think of your brain as a series of roads, right? It's an interstate, highway, back roads, frontage roads. And over time, like any good road does, it wears down, or you become really reliant on using specific roads to get home, to work, whatever. And when you're depressed, you've got the issue of not enough traffic in certain parts of the brain. So there's roads that aren't being used and overuse on others. And then anxiety is the opposite effect, right? Where you've got too much traffic in parts of the brain. And so effectively what ketamine goes and does is it not only generates those new neural pathways, but it also repairs potentially damaged pathways, maybe due to trauma or other life experiences, which effectively rebalances the load of the traffic in the brain. Is that right?
Yeah, that's a great symbolic way to approach it. And the only thing I'd add is that there are chemical signals that are part of those pathways, and the reset can be quantified in terms of those chemical messengers.
Okay.
And that is a profound benefit. So people take other medications for their depression. A classic one, or anxiety, is a serotonin reuptake inhibitor, SSRI, like a Prozac or a Paxil or whatever, something like that, Lexapro. That's an attempt to change the balance of the serotonin. Well, this helps reset the serotonin plus the dopamine plus the NMDA. So it's a much bigger, broader rebalance as opposed to just focusing on one neurotransmitter.
Got it. Okay, so that's a big history lesson in ketamine that I don't think a lot of people know about. So that was really helpful. You mentioned somewhere in there about its use on animals, and I'm sure if we did a Q&A of our listeners and what common questions they have, which that will be coming soon, so stay tuned. One of the most common questions is, but isn't ketamine a horse tranquilizer? Is that true? Can you walk us through that?
Absolutely.
And why we're giving horse tranquilizers to people for mental health?
So, we give seizure medications to horses too, and to dogs, and we give, a lot of medications cross over between mammals. They have different doses, different metabolisms, et cetera, but it is used in animals, and as a sedative, like it's used in humans, like Vietnam, or when you go to the operating room for your hip surgery or something. So different doses, different indications, but the chemical's the same, and so it's used by veterinarians for their medical practice of those mammals. We don't buy horse tranquilizer doses or get it from the farm store. The pharmacy, FDA things for the United States has got its own pathways that are super regulated and careful, and so it's funny to joke about, and it's kind of true. It's the same chemical that they're using for horses, but totally different dosing and functionality, and from what I understand, they aren't using ketamine to treat depression in horses. It's just
not yet.
just for the anesthetic use, but you never know.
Yeah. So, it also, to me, that suggests and, tells you something about the safety profile of ketamine. If it can be used in a wide variety of mammals, that says something about its safety, right?
Absolutely. They research it. Everything to get FDA approval requires a ton of research among animals and then humans and different levels of human studies. And ketamine is extremely safe, both for sedation purposes, for an anesthesiology type environment, as well as for mental health treatments. Obviously, there's different dosing, different monitoring. There's different ways you need to do it safely and correctly. But ketamine is extremely safe, and one of the more safe drugs for sedation and mental health compared to other things.
Got it. So you used the word FDA approved. So ketamine is FDA approved?
Absolutely. So FDA approval is about a medicine being safe and perform in a way that it is purported to perform. So if I'm going to get a drug that's FDA approved for pain, it needs to be safe and help with the pain. Mm-hmm. And there's a lot of different ways you have to go through to prove that. Ketamine's been FDA approved for decades. And its use needs to be monitored and careful and within the right appropriate ranges. But it's a wonderful medicine that's used in a variety of ways.
And so it's technically FDA approved for sedation and pain management, but not for mental health, right?
So this is where it gets a little interesting.
Okay.
IV and IM, which are most commonly referred to for ketamine for mental health purposes.
What does IV and IM mean?
So IV is intravenous. So you put an IV in your wrist or somewhere, and it goes to a drip on the wall.
Okay.
Or IM is just a shot, like a shot in the arm. That treatment modality, that dosing approach for mental health has not been officially approached the FDA for approval for that pathway. Okay. Whereas intranasal has approached and received approval for that. And there's a name brand called Spravato that went through the expensive, painful process of getting specific indication for mental health with that treatment approach. It's the same chemical, it's ketamine. It's just packaged in a way that gets absorbed through your nose, as opposed to your deltoid muscle here or your vein.
Which I know we're going to talk a little bit more about, but so technically the IV and IM is an off-label use of ketamine. Correct. Which, if I'm not mistaken, we use a variety of off-label uses of medications in our day-to-day
all the time.
Life. Is that something that prospective patients should be concerned about?
I mean, it means they need to pay attention and listen to practitioners that are experienced in the field to know what the right way to do it is. So the reason why it's off-label still is because no company has paid the millions of dollars to do the trials necessary to get it approved for that specific approach.
Got it.
And it's because the medication of ketamine, IV, and IM doesn't have a lot of money to be made, whereas this new formulation of intranasal got its own specific indication and thereby can bill insurance companies and get paid, and the company that paid the money for the research is going to make money back. That's why they went through the process. But if you were to say, hey, I'm going to go do a research trial on Tylenol for knee pain, and I'm going to get a specific indication for knee pain on Tylenol, acetaminophen, nobody's going to do it because acetaminophen is so inexpensive and there's so many different manufacturers out there, it's not of interest. We'll say, yeah, it helps with pain. Is it better than aspirin? Maybe. But nobody's going to research that and decide, oh, this type of acetaminophen is better. That being said, recently, 10 years ago or so, a little longer, there was an IV acetaminophen treatment, intravenous, which is, I didn't know you made intravenous acetaminophen, intravenous Tylenol. And they got that indication and they paid all the money to do the research to get the FDA approval for that possibility. And so never say never. Some company may want to go through the process.
So it could potentially happen.
It could. And to me, there's already data out there to say it's safe. There's very good data to say it's safe, it's effective, it does all the things that the FDA wants you to do, but nobody's paid the money to do the trials, to submit the trials to the FDA for that specific indication. That's a lot of nerdery about medical bureaucracy. The bottom line is go to a place where they know what they're talking about and they know the data and they've prepared to do it safely and effectively.
Got it. Okay. And so I assume because the drug itself is FDA approved, even if the particular indication or use of it in the IV-IM fashion for mental health is technically not, that it's legal to do. I mean, this seems to be a point of confusion for a lot of people, is this legal? I mean, I'm still surprised by the number of people when I'm preparing for this podcast and thinking about the questions to ask and talking to other people. And one of the most common questions still being isn't that illegal? So it's legal, right?
It's so under a medical practitioner, it's perfectly legal and medically indicated. Now, having ketamine parties that a doctor administers a ketamine for people to have that hallucination type event, that's probably illegal. And I wouldn't want to be that doctor because eventually it'll catch you. And there's stories about people throwing ketamine parties and whatever. That's crazy. But getting ketamine treatments for mental health is 100% legal and medically indicated and has tremendous benefit.
And it's legal in all states? This is broad across, and what makes it legal? What has to be true for it to be legal?
So the medicine has FDA approval, and the treating clinician, physician, nurse practitioner, CRNA, the treating clinician has to have privileges and competency in using that medication for what it's intended. And if you do those things, you're well within the law. Now, if you start doing ketamine parties, which is outside of medical indications and a little bit, shady medicine.
Yeah, no, we're not in the business of ketamine parties.
That's way across the line, and that's easy to say. That's freaking illegal. You're throwing drug parties. It's like if I gave you morphine for funsies.
Yeah.
That's illegal.
So then so you're telling me it's like a nurse or a medical assistant couldn't prescribe. Like, you need to be a prescribing licensed provider.
Correct.
To administer and say, yes, Ashlyn, this makes sense for you. I'm essentially writing the prescription for you to receive this. So at minimum, as patients are kind of like, prospective patients are searching around, that's one thing they should be very cautious of
100%.
Is that they have a prescribing provider, which is no different than someone who could write you a prescription for Lexapro or whatever.
And actually it's even more controlled. So ketamine is extremely monitored by everybody, state government, federal government. People's licenses are on the line to make sure you're not throwing ketamine parties. So when I write a prescription, there's a specific registration that pays attention to who's prescribing ketamine and how much and where is it and how you account for it in your storeroom and things like that. So ketamine is extremely closely monitored for good reason. And so it's actually harder to misappropriately use ketamine for people than something like Lexapro or Ativan or morphine. It's easier to misprescribe Percocets than it is to misprescribe ketamine. People will catch on to you very quickly if you're misprescribing ketamine.
Okay, so you can hear it here first. Ketamine therapy is legal across the board. That's not state dependent. Mm-hmm. States might have like some extra regs layers here and there, but at minimum, so long as you have a prescribing provider, which is not your friend, that's not your neighbor, that is not, and frankly, that's not your therapist either, right? Nope. Like your therapist can't even prescribe this. Therapists play a very important role in this process, but you need to be a medical provider to be able to prescribe this to a patient.
That's correct. Good summary.
Okay, so this is where I don't have all the information, but I know there's like a million different ways that ketamine can be administered. You've got the IM, which is the shot, right? You've got the IV, which is the traditional IV that in the vein, right? Mm-hmm. And then you've got troches, I think they're called, which are the oral tablets. Mm-hmm. And then you've got nasal, and then I'm sure there's a lot of other ones that are done recreationally that we won't spend time talking about because that doesn't serve a place. Yep. So can we talk about all these different methods? Is there one that's superior? What's the differences in like efficacy, experience?
Yeah. So, sticking with kind of what's best for mental health, IV or IM. So in the vein with the IV drip, or IM, one shot into your muscle, has the best evidence to support it for mental health. The outcomes are much more significantly improved from a scores of depression and anxiety standpoint. We talked about it briefly, the intranasal receiving FDA approval because they did research to prove that it had benefit, and it did, and it does. But it is not as effective as IV or IM. But it does have the benefit of having the specific indication, and thereby insurance companies will pay for it. So that's one of the kind of bureaucratic issues that, well, at least the intranasal gets paid for by insurance companies. We all have
Which is Spravato.
Spravato.
And Spravato's great. Yep. It serves a place. Anu will be bringing Spravato on in the next couple months, it sounds like. Right now, Anu offers exclusively IM ketamine, correct, so the shot, but we'll be bringing Spravato as an option for patients that are seeking insurance-accepted services. But efficacy-wise, they're pretty wild.
Yeah, it's the scores of benefit are significantly better with IV or IM.
Okay.
And the lozenges or troches, as they're called, the things you put in your mouth and suck on for ketamine, those don't have very significant benefit from a mental health standpoint. They're probably better than nothing, but I strongly would recommend Spravato as opposed to the troches. Generally, in terms of if you want the biggest benefit, the biggest bump in your mental health, IV and IM has the much better data and more promising results in every study. So.
And the troches, so like I think there's been this wave of at-home mail order ketamine services, which I know you have a very strong opinion about. So they use the troches, right? The oral dissolving tablet things that I imagine taste pretty terrible.
I wouldn't know.
Okay. Right answer.
And I've never prescribed it and I never will. I just don't think there's enough benefit and there's potential risk. There's so many risks. There's risk of abuse. There's risk of overdose. You're not getting monitored. The absorption we know is very different, and we think that's why the IV and IM is so much better. Is it's just in your system faster and all of it, as opposed to intranasal, only a certain percentage gets absorbed within the time frame, and then by the mouth we know a lot of it is not absorbed. So they call it bioavailability. So to me, the troches are all risk with minimal, if any, benefit at all. So I won't even bother, and I'll actively tell my friends and family, don't even think about it.
Yeah.
If you really want ketamine for mental health, get Spravato if you need insurance to pay for it, and if you can find a good relationship with your treatment facility, get the IV and IM, because that's the gold standard, best possibility.
Yeah. And this is the state of the world that we're in now, where it's like, how quickly can I get it? How comfortable can I do it from the comfort of my home, right? Do I need to re-say that, Sean?
No, but can you move a little closer to the mic? That's good. Your head just keeps kind of drifting.
Got it. Okay, sorry. So that makes sense, and the world that we're in is very much how many things can we make mail order?
Yeah, absolutely.
Your groceries, you've got,
Guilty.
Amazon.
Guilty.
Yeah, Amazon really set us on that course
of
like, I should be able to get that to my door, including my ketamine. And I know there's a lot of online providers out there that, and this is not to disparage or anything, that I think put a lot of effort into trying to put some guardrails in to create safe environments at home. But the reality is, you are at home. You are not being medically supervised. I know some have like virtual Zoom calls or things maybe with a provider. But if something went wrong, they can't climb through the screen. They can't climb through the screen and help you. And, of course there's the abuse component, right? But let's say the vast majority of people that are doing it have good intentions, and they purchase it and they are hoping to make materials, improvements in their mental health. And they read their dosing instructions and it says 1 troche and their brain sees 11. And they take 11. And it was a mistake. It was a genuine mistake. But now you've got a real issue. You've got a medical problem, right? And there's no one there to help. And that is what I think scares me about those programs, is you just are not set up for success. And I know a lot of people that have actually had like personal successes with them. But again, the data doesn't lie in that the efficacy rates with IM and IV are just far superior. And then when we think about risk mitigation, it's very clearly...
Yeah, I mean, it's a controlled substance. It's DEA monitored, and you're sending a controlled substance to somebody's house in the mail. And then
it's compounded.
Yeah.
Which means what's the difference between a compounded ketamine and like the ketamine you would get in IV or IM?
So there's less oversight and quality controls. And you can get anything in the mail, right? The thing is, it may be laced with bad things. I'm being really dramatic, but there's not a lot of benefit and a lot of risk. And for me, the real trade-off is, well, if you need the ketamine for mental health, get it so it works.
Yeah, you're gonna invest.
I mean, instead of just playing with fire in your basement. I mean, the other thing that we've talked about briefly is the monitoring component, like doing it safely. Like we're talking, so ketamine as an anesthetic is performed by an anesthesiologist. And for mental health, you have specific criteria for doing it safely and correctly and having the right monitors available and the right people available to intervene. Just like you described, you can't climb through a screen.
Yeah.
And one interesting thing is the state of Utah actually has a statute about administering ketamine for that reason, that says if you're going to administer ketamine on your facility premises, you need a practitioner who's experienced at managing and monitoring an airway, let alone the cardiac monitoring. Like, so you don't want to just take it and go lay down in your easy chair and wake up 8 hours later. That's a recipe for disaster. Instead, go to a facility that takes care of you, that monitors you, has the right people in the building at the time, et cetera, et cetera.
Okay, and then I know, like, there's, obviously we're talking about how it's administered. We're not at all talking about what does it feel like, what does the process look like, how are you being monitored, all of those things. That will be our next episode, where we kind of dig into that a little bit more on what the process is. But today we really just want to kind of focus on the foundational layers of, legality, the history, the research, which, let's talk about the research.
Yeah. That to me is the most interesting.
It's so cool.
Yeah.
I mean, like, you do just a few Google searches and you're like, to be completely honest, you look at some of this and you're like, this is sort of unbelievable.
It's
like, I almost don't believe it.
100%. And as someone who's used ketamine in my traditional medical field for a decade for other reasons, it blew my mind. The body of literature, the amount of research that's well done, New England Journal, British Medical Journal, like very good publications, peer review, best of the best, demonstrating substantial benefit for mental health. So refractory or severe depression, anxiety, compared to standard of care, which could be electroconvulsive therapy or shock therapy, as we remember from yesteryear, there's no comparison. Ketamine is far superior. Other trials that once we decided ketamine's safer and generally better than ECT, showing rapid decline in suicidality. Patients that are so depressed they're ready to end their lives, and we give them emergency ketamine treatment, and within half of the series of treatments, so 3 treatments, most patients are no longer suicidal. So it's almost like a light switch. Now, they're not perfect. Their lives still have a lot of work. There's still a lot of things that need to go on.
Yeah.
But that, in terms of research, compelling research that tells you, oh my gosh, I want to do that medicine. I haven't seen something like that in I don't know how long.
Yeah.
So of course I'm drawn to this because I have so much experience using ketamine for the hip injuries and for the sedation and for these other experiences in my medical practice. But interestingly, in our institution at the New Therapy, I want to treat it like I treat other parts of my healthcare, which is to measure, is it doing what I want it to do for my patients? Are we getting the outcomes we want? And so we're actually measuring on our patients their severity scores before, during, and after. And our scores are even better than the published literature. And these are blinded. Patients can tell us whatever they want. And it's de-identified. We just get the scores. And our scores of severity for depression, anxiety, 80% of our patients have a greater than 50% reduction in severity of symptoms. So we're talking, their lives are almost worth ending to them. They're willing to kill themselves. They're at the end of their rope, literally, to life's pretty okay by the end of the treatment. And I know we all want to live better than life's pretty okay.
Yeah.
But that is so significant. That when you have a loved one that is that mentally ill and that hurting so badly, and to be able to pull them back from the brink.
Well, it's so that you mentioned the British Medicine Journal.
British Medical Journal. Yep.
Yeah. So that one was a suicidality trial that was done, and if I'm not mistaken, and we'll link it in our podcast bio, that of the participants who received ketamine versus placebo, of all ketamine injections, after 3 days, suicidality was in full remission.
Yeah.
Remission. I mean, you think about how powerful that is when suicidality is something that unfortunately just continues to grow in our country. Yep. And, there's a lot in the world that makes suicidality and mental health a growing issue. And to know that providers have an option, that when you have someone that comes to you that says, I'm going to harm myself, and there's something that you can do that could potentially give them fast acting relief to unwind that toxic thinking. I mean, you almost want to use words like curative, like that. I mean, that is like mind blowing.
And you know, as a doc, you're thinking, what are my alternatives? What else can I do? What can I do to help this situation? And my experience in training, you know, I participated in ECT shock therapy. I was watched it as a resident and as a med student. I watched ECT, and wow, that's a really invasive thing. I saw benefit. I saw patients go from truly suicidal to not suicidal to kind of working on their lives. But the things I've seen from ketamine and the over and over and over, which reinforces what the published literature says, means to me there's no comparison. There's nothing to talk about. I mean, if you can't have ketamine for some reason, okay. But if you have any loved one that is their life is that altered by mental illness, ketamine changes their lives. And I've seen it over and over, and miraculous is the word I would use. And I've had friends who've lived it. And so it's even more touching to see your friend and loved one go through this transformative experience and go from their life was not worth living to them because of these bad neuronal ruts, right? We talk about the road, the pathways. They're in a rut, a neuronal rut. Their neurons are in ruts. Shift the neurons, shift the pathways, climb out of it, and they're able to make their lives worth living and better and better and better. So I'm very passionate about this, but when you see it as a clinician, that's why you go to training. That's why you go to school. Yeah. It's like, oh my gosh, look what I get to do to help these people with this terrible problem that doesn't have another good solution.
Yeah.
Inpatient psych units, if it's just inpatient, there may be some medications involved. I hope it can help. But gosh darn it, if they're suicidal, I want them to get ketamine because I know from the literature and from the patients we've taken care of with our own data, that suicidality is going to go away. They're going to be better enough to start working on the rest of their life. And then, oh, by the way, the patients that weren't suicidal, they get a huge benefit too. They go from I'm really bad to, I'm pretty good. And this is, I'm being really general, but we have good survey data that's validated among the literature of research of depression and anxiety that has number scores that show very clearly, hey, you're a 9 out of 10 on bad, you're now a 3 out of 10 on pretty good. So I'm using general terms, but those numbers are there and they're well validated. So it's obviously I get really excited about this.
We can tell. We like it.
but man, I had a really good friend of mine who his son was admitted for suicidality, and the first thing I said is, get him to ketamine at some point, and I'll take care of it at my facility if you can get to my facility. He was in another city. It's kind of awkward. He may end up still coming to my facility. I don't care. Just somewhere, ketamine. That's going to set him up. That's going to tee him up for reversing this downward spiral of self-destruction.
Yeah, and Hugh, we should probably add this to the beginning. We missed a big piece about conditions it treats. So we're talking about ketamine therapy for mental health. So like, what is mental health? What are the conditions that we're talking about here in terms of what it treats?
Yeah, so it became most apparent with sustained, consistent benefit in severe depression, and then they studied it in anxiety. And depression and anxiety are kind of like two sides of the same coin in terms of neurotransmitters, so it makes sense. There is 6 month to 12 month benefit, relief, cure in some cases of depression and anxiety that previously was treatment resistant or refractory.
And treatment resistant means?
They had tried multiple medications over the months to years, didn't get enough benefit, or the side effects were worse than the benefit, and now all of a sudden, hey, this worked. This other stuff didn't.
Yeah.
And they've tried it. They've tried the other stuff, and it didn't work.
So the bread and butter, like where it really got its name, was treatment-resistant depression,
yes.
PTSD, and then anxieties come along,
yes.
and there's more and more suggesting its impacts on anxiety, as well as OCD, which is a flavor of anxiety,
yep.
and then chronic pain, which makes sense given that
So the chronic pain that's an interesting one, because we know in the medical world that uses ketamine for its traditional uses, it affects the mu receptors, which is your pain receptors. And so you can actually, there's really good research on trying to decrease the amount of narcotic or morphine type medicine, which is Percocets, oxycodone, OxyContin, morphine, Dilaudid, fentanyl. If you're trying to decrease that use, you give them ketamine, there's good research that they get just as much pain relief with almost half as much narcotic.
Which brings us to a good point. Another common critique is this addictive? Am I going to get addicted to ketamine?
It's actually the opposite. So ketamine will help you with your addiction. It's been used frequently for chronic pain, because they get dependent on these narcotics. Usually is the medicine that's most used, and you're able to use this as a bridge to help them wean down and decrease and maybe even come off. I wouldn't use just ketamine to get all the way off of narcotics, but it's a very useful tool along that pathway.
Well, and the doses are so small. You mentioned at the beginning, right, that you've got the aesthetic, surgical related doses, and then I imagine the doses for mental health are very different, significantly lower.
Oh, absolutely. So anesthetic doses are 5 to 10 times more, and you're giving it repeatedly, or a continuous infusion, IV infusion during the whole case, or during, like when I use it in the intensive care unit, I generally keep it going the whole time. So you're getting like 100 to 1,000 times the amount in a 24-hour period. Versus if you're coming to mental health for ketamine treatment for mental health, you get a very small dose in your arm, and that's it. And you do dissociate. The point is, you do want to be to a place where your neurons are interacting in ways that are different than baseline. So dissociation. But that's it. You just go to there and stay there, and that's it. It's a very, very small dose.
Small therapeutic dose. The research, which we'll also include in our bio, there's been studies done on the addiction of ketamine, and in almost all cases that they researched, they were recreational illegal uses.
Totally. They were using it to get high, and people get high and want to keep getting high.
And the dose goes up and up and up as the tolerance goes.
Yep.
So there is no research, period, to suggest that therapeutic dosing for mental health causes addiction.
Correct. There's no chemical dependence on ketamine, that your brain craves it. And if you use it to get high at those inappropriate doses, and you will have a problem there. But that's a separate beast that has nothing to do with mental health. And we won't be able to get you any ketamine to get you high. If you're going to come to us, it's going to be to treat your mental health, and when we're done with the mental health treatments, you will not need it. You will not be dependent on it. You will not be addicted to it. And we can treat your other dependencies and other addictions with the ketamine. So that's the best part.
Okay, well, we have covered a lot of ground today, and we've got a lot of episodes ahead of us where we want to deep dive a little bit more into the experience and the sensation, and I know that ends up being a lot of people's questions, because for a lot of people it's pretty novel.
For sure.
But in terms of closing out for today's episode, I think stigma is something we talked a lot about, and is really unfortunate that is one of the most prevailing issues in, I think, patients seeking the help that they deserve. So when your message that you would give to someone who has been thinking about this, has heard about it, but is concerned, scared, maybe a little less so after listening to our episode, what would be your message for them?
I mean, it goes back to the efficacy. This stuff works. And obviously we keep everything completely private. We're federally compliant with all the privacy laws, and so you don't have to tell anybody. So you can keep this completely secret and get the treatment you need. But if you have treatment-resistant depression, anxiety, PTSD, OCD, even chemical dependence for other pain medicines, get help. Let the stigma be someone else's problem. You're going to get the help you need, and it's going to work. If it didn't work, I'd be like, okay, well, whatever. But you're going to get the help you need that's going to work, and they'll be completely private, and you can tell whoever you want to tell. Don't tell anybody. Tell your mom, whatever you need. But don't let this weird lack of understanding prohibit you from getting a medically life-saving treatment, life-altering, life-bettering. Don't let somebody else's crazy ideas interfere you from getting help that will help you. I promise you. We have our own internal data that confirms the published research. It's mind-blowing how beneficial it is. So please, don't let somebody else's weird ideas who's, talking around the water cooler prohibit you from getting the help that you need.
Yeah. And it's simple Google search to do your own research at this point. It's so accessible. The really great information out there.
Oh my gosh, they're really good studies. Like, this isn't like voodoo. This is good stuff.
Yeah. Well, Dr. Gilmore, thank you for your time. This was incredibly enlightening, and I know this certainly won't be the last time that we have you on our podcast. And thank you for all your contributions, and we'll see you soon.
My pleasure. Thanks for having us.
Thank you for joining our very first inaugural podcast with A New Therapy. If this was interesting to you, subscribe, follow us. We're on Instagram, we're on YouTube, we're on all the things. We'll include all the links in our bio. If you have specific questions that pop up that you want us to explore or concepts, feel free to send us a message, and we'd be happy to